Hi, Dr. Rutherford here, and today we're going to talk about suffering with chronic diarrhea. And interestingly enough, we see a lot of that. It kind of goes in the order of irritable bowel syndrome, chronic constipation, and chronic diarrhea. And look, it's it's all gut. Okay, it's all something wrong with the gut. And of course the question once you dig in there is what is the root cause of this, and there's a little spectrum of what goes on with that. The number one suspicion when somebody comes in there is they always go, do I have parasites? Do I have parasites? It's like, look, have you been to another country? Have you been drinking water up in the mountains? No, it's not parasites. And so really, usually by the time a person comes here, they figure out whether it's parasites or not. And most of the time it's not. But if you've done one of those two things, if you've gone to Mexico or you've gone out of the country, you're having chronic diarrhea, you haven't checked that yet, check it. That's definitely a possibility, but that is history driven. Have you been there? Have you done this? So now we get to the next one. The second most common cause of chronic diarrhea is abnormal imbalance in the bacteria of your bowels. And I know if you look up chronic diarrhea online, that's not the top of the list of what Dr. Google says it is, okay? But that's what it is. And so how does that happen? So how that happens mostly, obviously it can happen from, eating at McDonald's every day for like the next 30 days. And that would create a situation in which it would create imbalances that were irritating the inside lining of your stomach and more your intestines, and certainly that could be an issue. Most of you aren't doing that, or you wouldn't be watching these things. So the next thing is usually, to me, the next thing I see in the next hierarchy is stress. Stress. The next two things would be stress and small intestinal bacterial overgrowth. This is what I see in my practice in this order, okay? And so stress. So basically stress paralyzes your stomach, pancreas, gallbladder, and intestines. And for those of you who haven't seen me talk about this ad nauseum, because stress can cause nausea too, then it basically, when you're in stress, when you're in a chronic stress flight type of thing, this is nature's way of preparing your physiology to be able to use your strength to fight or your endurance to flee. And so your chemistry is rearranged that way, and eating and pooping are not things that your brain or your neurology thinks are important when you're fighting or fleeing. So what it does is it shuts down your stomach. You start not making the proper hydrochloric acid. You start not digesting your proteins. More importantly, you stop not sterilizing your food. Hydrochloric acid sterilizes food in the stomach. What does that mean? It means that it's supposed to be killing bacteria, killing viruses, killing funguses, killing candida, killing H. pylori. It's supposed to be killing all that stuff. When it's not doing that, now that's going to tell your gallbladder not to work. That's going to tell your pancreas not to work. That will create a bunch of issues relative to food sensitivities. Food sensitivities can cause chronic diarrhea. Every time you eat a food, it gets past that gauntlet. It's not digested right. The inside of your intestines has this immune system that flares up. There's little cells called dendritic cells, just so you know what I'm talking about. And they come out, and they're called macrophages, and they're supposed to take that little piece of food and test it and say it's okay. Well, the oil goes, no, it's not okay. It says, I don't know what this is. It's not digested. It doesn't belong here. In the meantime, it's signaling to the inside of your intestines, where your immune system, 70% of it is, to start flaring up and attacking that food. That flare up over a long period of time is going to cause diarrhea. Okay, it can cause leaky gut. It can cause a ton of things, but it can cause diarrhea. A lot of that mechanism will result in imbalance in bacteria. The intestines should have an imbalance in bacteria. It should be about 80-20, 80 good, 20 bad. Yes, there should be bad bacteria in there. There should be a balance. And then what happens is you start creating more bad bacteria. You start getting too much bacteria. You get small intestinal bacterial overgrowth. The next thing you know, you may get constipation. And before you get the diarrhea, but basically once you start not moving your bowels, the entire chemistry, the bacterial imbalance occurs in your intestines. And the next thing you know, you've got chronic diarrhea because now you got all these bad bacteria. They're altering the environment on the inside of your intestines. And your intestines is saying, get that stuff out of here. Like, I'm not even going to deal with it. And it absorbs the water, stops absorbing the water, I'm sorry, because the inside of the intestines can't do what it's supposed to do, and you get chronic diarrhea. But the point is, stress is a big player, but not always. Anything that causes your stomach to not, you could have autoimmune gastritis, you could have H. pylori, you could have overriding of candida, you could have autoimmune gastritis. You would test by running something called parietal cell antibodies. You could have that. Certainly you could have food sensitivities, but you get the food sensitivities because all the other things are there. So, I mean, look, it's a the most time it's a breakdown of your digestive system. It may be because you're eating junk, maybe because you're eating too much sugar, maybe because you've developed 50 food sensitivities and you don't even know it. And stress will cause all of that. And so those are really the things that most of the time, I mean, if you're chronic PTSD, think stress. All right. If you're type A, think stress. If you're not a type A and you're not PTSD, but you're working at deadlines all the time, or you're involved in a divisive emotional trauma, think stress. If you have anxiety, think stress. Can't tell you the number of people who've come in here and go, you know what, I had anxiety and my doctor gave me Xanax and all of a sudden my diarrhea went away. So how did that happen? This is how it happens. So it's like, you know, when full admission, when I first got into this, I was like, diarrhea was a mystery to me. And of course I had all these people coming in who had diarrhea and I had no clue what to do with them at that time. And you learn and then you go, oh, okay, this makes sense. It's not exotic. It's not, you know, Montezuma's revenge is because you went out of the country, ate a bunch of food that your immune system wasn't used to, or you got bacteria that your immune system wasn't used to because it was a different location. You get it. You go up in the mountains, you drink the water, you get a parasite, you get it. Okay, but other than that, it's some aspect of this broken down digestive chain. If stress is a problem, you got to take care of the gut as well as use something. Now, I don't use Xanax, okay? We probably would use other things that would reduce your stress, like herbs, botanicals, brain rehab exercises. I also do chronic neurology as well as functional medicine. I said functional neurology as well as functional medicine. And so that's kind of the summation of chronic diarrhea. Look, there are other more pathological things that can cause it. That's not the subject of what I would be talking about, because usually by the time you came here, you would know it, because that's what the medical doctors look for when you go and ask about it. They'll test you for poor function, poor pathology. They'll do upper GIs, lower GIs, and if you have that pathology, they'll usually find it. For the people who come here, for the people who are usually looking online, that's kind of the core of what causes chronic diarrhea.